Hi everybody, this is Kat. If you haven't seen any of my other videos, I am a longtime patient of Dr. Wright. He's been treating my lipedema for the last few years, and I am scheduled to have a total of 5 surgeries for my lipedema, and I've gotten 2 done. Thanks to COVID, I'm a little behind. I'm very anxious for my 3rd surgery, but I wanted to do another video and update you guys on what my life is like after recovering from my 2nd surgery. So I'm in total supposed to be getting a liposuction treatment for the front of my thighs, the back of my thighs, my calves, my abdomen, and my arms. I've already done the front and back of my thighs, and the next the next area I'm looking to treat will be my calves. So I did get, it's been actually almost a year to the day since I went in for my 2nd surgery, which was the back of my thighs and my butt. Dr. Wright took out 12 liters of lipedema fat and fluid, which is insane. The next day I went in for a post-op and had to get 2 IV fluids put in because it was just so much, which I'm very grateful for, because now that I've recovered, there's just so much more I can do already. It's a really interesting experience right now because I'm halfway through with my legs, or a little over halfway through. So I have almost no pain in my thighs or in my butt area. No bruising, no swelling. In total, I've lost probably about 35 pounds between the surgeries and just my own efforts since then. But then in my calves, because they aren't treated yet, they are almost getting a little bit bigger, probably because the fluid is just migrating to different areas, and I still feel the same pain and bruising. So it's a nice reminder when I feel it in one area, I realize I'm not feeling it in another area that I'm very used to feeling it in. So that has allowed me to do so much more. Even right now, I'm coming at you from my home gym, and you can't really see at this angle, but I'm sitting Indian style, which is just, I mean, you ladies with lipedema know it's just unheard of. The first time I came in here to do a workout after healing, I didn't even realize that that's how I was sitting, and I just broke down in tears. The littlest things, you all know, that people don't even think about are really painful and embarrassing. You know, I'm a avid yoga goer, or I was prior to my lipedema progressing to later stages, and I needed alternate positions for almost everything, and now I don't. There are still some things that are a little painful in my calves, but that's 1 out of 3 areas on my lower body, so it's just been a godsend. Overall, I do a lot of weight training in my workout routines, excuse me, and I like to focus on trying to build muscle. It's a bit of a mental struggle. You all probably know lipedema fat is not responsive to diet and exercise. So the exercise I do, I have to just keep that mentality of I'm building up my muscles so I can slow progression. And then after I have all of my surgeries, I'm doing that so that I can maintain the results without having to experience all of this all over again. So that's really where I'm at. I try to work out about 3 times a week, and I am seeing progress. So you'll see, like, you know, I have definite lippy arms. You know, I'm lucky that my upper body isn't as affected as my lower body, but I have the wings here, and I have see, I have those cuffs here still, so I can't wait to get rid of them. But since I've started working out, I have increased my weight significantly, the weight that I can lift, I should say. I started using 10-pound dumbbells, and now I'm using 25-pound dumbbells. So there are some good wins there. And so I just want to encourage you, there is light at the end of the tunnel. And even though this is a progressive disorder, there are things we can do to kind of keep up with it. And then especially after getting treatment, ways to maintain those results. That's all I have for this video, but I'm sure I'll come at you with more. If you have questions or if there are other topics you'd like me to cover that you're curious about, just reply in the thread and I'm happy to create some more for you. Thanks, guys.